Hi, my name is Kathy Burgess, and today we're going to be learning about how to prime our EVD system. So the first step we're going to be doing is wiping down the pole. So put on some regular gloves, and we'll wipe our pole down.
Please note at this time we want you to get a piece of tape and put it on the pole for later.
Get rid of that. And sanitizer in between, and then regular gloves again.
So before opening the system, please put on a mask.
Open up your system, and you do not need to be sterile at this point. And I usually take the system out of the big box. So you're going to open this carefully. And then what we're going to do is we're going to dump all of the supplies into the box itself. So our transducer, two of the white rim tubs, and our sterile syringe.
And now that we have everything in the box, we can now get sterile. So we'll take off our old gloves and we'll get out our sterile gloves and put those on.
This box. Okay, now what we'll do is we're going to put together as much of the EVD as we can before we attach it to the pole. So if you open up the drain, so carefully trying to keep as sterile as possible. So if you're looking at the system, this is where one of the white rim tubs will go and the transducer will go here. So we can attach the white rim tub. This is where CSF collection will be done. And the transducer will attach here. Okay. And in the transducer package, there's a closed end cap that will eventually go onto the end here that we'll save for a little bit later. So at this point, we're going to attach our drain to the pole. I usually hold the tip in my hand just to keep that as sterile as possible. And then we'll very carefully, without touching the pole, attach it to the pole. There's a little blue guy here that will there we go. Okay, next step is we're going to take our sterile syringe and attach it to this most farthest away, the most proximal to the brain port here. And the first step is going to be flush to the tip. So you're going to turn your stopcock off to the system and flush to the tip till it drips. And then you're going to turn this one off to the tip and it will stay there for the duration, okay? The next step is to flush all the way to the buretrol itself. So this stopcock is off to the transducer. So all the way up until it drips. And then you will turn the transducer stopcock off to the Buretrol, and we're going to flush out the transducer. This stopcock will now stay this way indefinitely, and so I always remember it as they're going opposite directions. So next step is we're going to flush out the transducer and replace it with one of these closed end caps. So I usually remove, as I'm flushing, I remove the cap and replace it at the same time. And there we go. Last step is to replace the last white rimmed hub with the syringe. And again, we're not turning any stopcocks so that we won't lose any, we won't suck back any fluid. The last white rimmed hub goes there. And the last thing we're going to do,
now we're going to peel the sterile glove off over the tip of the EVD and use the existing tape that we put on the pull at the beginning of the setup to secure that tip and hand it to the surgeon when we are ready. And that's it.